So, how many questions will come from mental health, psychosocial aspects? It will be 15 plus or minus 5. So you're going to get 10 to 20% of questions will come from psychiatry, mental health related issues. Which are the following patients? It's at the lowest risk of developing fecal incontinence. A 79-year-old man with long-standing diabetes and fecal agency. B, 45-year-old woman with chronic diarrhea and central obesity. C, 63-year-old man with urinary incontinence and prior pelvic surgery. D, 30-year-old man, 30-year-old healthy man with no comorbidities. E, 50-year-old woman with multiple vaginal deliveries and pudendal neuropathy. Which of the following patients is at the lowest risk of developing fecal incontinence? This is a very, very simple, easy question. You should be able to grab it quickly. It's a 30-year-old healthy male with no comorbidities, okay? So fecal incontinence is uncommon in young, healthy individuals with no risk factors. All the rest have risk factors. So A is at risk due to older age, diabetes, fecal agency. That is the 79-year-old woman. B is at a risk because of the increased abdominal pressure from a central obesity and a chronic diarrhea. Okay. C has urinary incontinence and prior pelvic surgery, and so these are all risk factors. And E has obstetric related pelvic floor injury, which is increasing her risk for incontinence. Okay. Next question. You have a 76-year-old woman in a long-term care facility. She's noted to have fecal incontinence that worsened over the past few months. She has a history of dementia, central obesity, and recurrent Clostridium difficile infections. Based on epidemiologic data, which of the following is the strongest predictor of fecal incontinence in this patient? Strongest predictor of fecal incontinence in this patient. A, central obesity. B, dementia. C, recurrent Clostridium difficile infection. D, advanced age. E, female sex. What's the correct answer? If you're a Newcastle fan, you should be very happy. I have a colleague physician. He's a senior colleague. I can't mention his name. But after this class, you know exactly what I'm going to do. I'm going to laugh. He's a strong Liverpool supporter. So all the Liverpool supporters, I'm sorry. I'm going to laugh. Okay.